is dying. The fact that he sees you, the way you smile, the way you attend, your attitude towards the person should inspire the person to live. So this should be something we should carry us all across. That let every breath we have, as we come to work, to ensure that somebody sees you and says, because of you, there's life, there's hope, so I will live. We also talked about emotional intelligence, which is very important for every health personnel. With this, it makes us aware of ourselves. You know your downs, you know your up, you know when you are angry, you know when you are sad. But because you have emotional intelligence, when you come to work, you are able to control yourself. When you should be angry, you are not angry. You even smile. When you should be firm, you are firm. You are able to regulate your temper. You don't talk anyhow. You don't behave anyhow. You know how to relate to your subordinates. You are able to also be aware socially about yourself. In a social environment, you know how to relate. And it also helps to build a healthy relationship. Anywhere you go, no matter how difficult the place is, you are able to build relationship. Then finally, as you assess yourself, you're able to live your life.
I'm Mensa Kufuor, Head of Clinical Psychology Center, Greater Accra Regional Hospital. The reason why we organize this auspicious program is to promote mental health awareness amongst the population in Ghana. And we realize that the knowledge of mental health is really quite low. So we try to start this organization. We started from 2019. So every year, apart from the COVID period, we have been celebrating these week celebrations. So that is the fourth mental. And this is the fourth Mental Wellness Week celebration since 2019. Yes, and this year is to talk about the fact that mental health matters, empowering life, inspiring hope. We think that we need to help people. We need to help with the advent of the 4 mental health disorders, namely depression, anxiety, stress, depression, anxiety, schizophrenia, and bipolar. The Mental Health Authority has also, tried to empower the life of people by enabling them be able to access care with regards to mental health, free care with regards to mental health. So that's also a way of empowering life, and then also inspiring hope in the fact that in future there will be other disorders that will be added to the mental health, the National Health Insurance Scheme, so that people will be free to talk about mental health and get the best treatment and be able to complete the treatment that they start when they see their mental health providers. I even had a client's father who came to us, and the last resort he came to us. He's been all over the place. He's gone to the religious institutions and all that. It's not. That's not to say that some of the religious institutions are not doing well. They are doing well. They talk about mental health. They involve the mental health providers when it comes to the care of people with mental health disorders. But others would take exorbitant money, take advantage of them, take exorbitant amount of money from them, and not to provide any care or even direct them to the right quarters. So they end up going all over the place, wasting lots of money, only to come to the hospital and know that there's avenue for care, and then there's relief within the hospital, because we have mental health units within the hospitals and most district hospitals in the country. So it's really sad that this happens, but we are continuing to engage the religious leaders so that they involve mental health providers in the care of their congregation, because their congregation see them as the first resort. But if they are able to guide them properly, we'll be able to together achieve greater good for the welfare of the population.
What I suggested is that mental health is not just a total health condition. Mental health encompasses every faculty of our lives. Like I mentioned, if you understand the relevance of time management, you will know that it has a total impact on your mental health. If you don't have a good relationship with your own self, and in that regard, it also doesn't allow you to have relationship with other people, it affects your mental health, because you are first of all a social being, you are second of all an emotional being. So how you relate with yourself and others will also have a toll on your mental health. Then I also mentioned about career. If you are not purposeful about your career, even getting out of bed, you look at what you go through as journalists. So when you pick mental health, it is not only limited to the four walls of hospitals, Pantai, Asalam Down, Ankafo, but it is about our total life and in a holistic sense. So that's what I mean by when you limit mental health only to the confines of hospitals, we cannot grow, develop, and become the best of a nation we want. Our investments, our impact, our preparation, our even national policy about mental health, it's nothing to write home about. If not so, how many national facilities do we have in the area of mental health? Like I said, readily, what would you remember? It's Pantime, it's Ankafo, or in Accra, Asalam Down, or Asalam as we call it. A nation that takes its people seriously, you don't only invest in the cliche economy, you also invest in the quality of education, quality of food, quality of recreational centers. In Accra, where are the recreational centers? Those days you find people were playing football, children's park here and there. We don't have all those things anymore because we've built high-rising buildings on them for corporates. So if you look at all the indexes, the Global Happiness Index, Psychological Safety Index, Global Emotional Intelligence Index, you realize that Ghana lacks in all. We are lagging in all. That should tell you that a nation that does not prioritize the mental health of its citizens, you don't get the best out of them. Look at from the government level. Can we go and veto the budget allocated for the Ministry of Health that goes directly to the Ghana Mental Health Faculty? You will be shocked what you will find there. Two, if the government is not doing it and the right conducive environment of economy, food security, physical security, growth, education, health, if all these, if you put it into the global parameters like the Human Development Index, if these we don't measure up right, then you are not taking the nation seriously, and this is what you will find. But what is important is on the individual level, nobody can love you and take care of you more than you can do for yourself. So if it is not coming from the government, let it come from you to you and share with others. The quality, the health of a nation can be measured by the mental health index of the nation. And because mental health is not only a hospital situation and it encapsulates everything we are, it also means that we are responsible for who we are. We become the best we can be if we have the right mental state.
Times we tend to shout, some nurses, we often hear this thing very often in our communities, that they go to a hospital and the nurses are being disrespectful and all that. So if we learn how to understand the patient or the client, maybe the condition the patient is in requires the patient to show pain. So in pain, they can alter certain words they are not supposed to alter. They can say whatever that they want to say. So if you are a nurse and you have empathy and you understand that the patient is talking out of pain, instead of you to shout back or to respond in a negative way, the nurse should rather get close to the patient and explain to the patient that, I understand why you are feeling this way. It's because of the pain you are going through or because of the condition that you have. And the patient may not even understand the condition. So even if you explain that, with this your condition, it's possible for you to show such behaviors. So I understand you. So if you are shouting or you are angry, I'm okay, it's fine, it's part of it. But and then you teach that patient coping mechanisms, how to cope with the condition, how to cope with the situation, so that when the patient goes home and you are not there, he or she may be able to manage the condition.
Lovely meeting we had is that people out there should stop stigma. We should all ensure that we take care of one another when it comes to mental health. It's not only about those on the streets, but it's all about how we relate with ourselves and then how we manage our emotions. So let's make sure that our emotions are in check.
Mental health can be transgenerational. That means that my mental health today can affect my offsprings or my children, and then they can also transfer it to their children and their generations after them. And so taking my mental health as one of the important things in my life should be something that I have to do. And also what I learned is that everything in my life affects my mental health. Even my time management affects my mental health. And so I have to be very conscious of my time management. I have to be conscious of the relationships I keep, because they can also affect my mental health. And lastly, emotional intelligence. Sometimes if I'm not emotionally intelligent, it tends to affect the people that I relate with and then the relationships that we share. And so this program has been very insightful and educative, and I would advise that everybody takes their mental health serious.